There's a daily habit that 68% of people over 50 engage in multiple times per day, and it's clogging their arteries faster than bacon, butter, and deep-fried foods combined. Cardiologists are calling it the silent arterial assassin, and the shocking part is that most people believe they're doing something healthy when they do it. Before this video ends, you'll discover exactly what this habit is, why it's more dangerous than the foods we've been warned about for decades, and most importantly, the precise protocol to reverse the damage that's already been done. If you're over 50, what you learn in the next 28 minutes could add years to your life. But first, if you value your cardiovascular health and want evidence-based information that challenges medical dogma, hit that subscribe button right now. This channel exists to give you the truth that conventional medicine won't tell you, and today's revelation is going to shock you to your core. Let me tell you about Margaret. 62 years old, health-conscious woman who hadn't eaten fried food in 15 years. She walked 30 minutes daily, took her omega-3 supplements religiously, and her diet was what most doctors would call exemplary. Low-fat, whole grains, plenty of fruit. Then one Tuesday morning, while doing her usual yoga routine, she felt a crushing sensation in her chest. Within 45 minutes, she was in the emergency room being wheeled into surgery for an emergency stent placement. Her cardiologist found 3 arteries with 70 to 90% blockage. Margaret was stunned. How could this happen to someone who did everything right? The answer is going to shake your understanding of heart disease to its foundation. Here's what's happening in your arteries right now, and why everything you've been told about preventing heart disease is dangerously incomplete. For the past 40 years, mainstream medicine has focused obsessively on dietary cholesterol and saturated fat as the primary villains in arterial disease. We've been told to avoid eggs, red meat, butter, and anything fried. Billions of dollars have been spent promoting this message. The American Heart Association built their entire dietary recommendation structure around it. And yet, despite 50 years of low-fat dogma, heart disease remains the #1 killer in developed nations. Cardiovascular disease claims 1 life every 36 seconds in the United States alone. That's 2,400 deaths every single day. Something doesn't add up, does it? Recent research published in the Journal of the American College of Cardiology has revealed something that's turning cardiology on its head. The study followed 14,000 participants over 12 years, monitoring their arterial health with advanced imaging technology. What they discovered was extraordinary. The single strongest predictor of arterial plaque formation wasn't saturated fat intake. It wasn't dietary cholesterol. It wasn't even lack of exercise. It was chronic elevation of blood glucose and insulin, specifically the pattern of glucose spikes that happen multiple times throughout the day. Let me translate that into plain terms. The daily habit that's destroying your arteries faster than fried food is eating in a way that causes repeated blood sugar spikes. And the worst part, the foods causing these spikes are the exact foods that conventional medicine has been telling you to eat for heart health. Now, before we go deeper, let me be absolutely clear about something crucial. If you're experiencing chest pain, shortness of breath, pain radiating to your jaw or left arm, sudden severe sweating, or unexplained nausea with upper body discomfort, you need to call emergency services immediately. These are signs of a potential heart attack, and every minute counts. This information is educational and should never replace emergency medical care or the advice of your personal physician. Everyone's cardiovascular situation is unique, and what I'm sharing today must be adapted to your individual circumstances under professional guidance. With that said, let's expose exactly what's happening inside your arteries and why your morning routine might be setting you up for a cardiac event. Your arterial system is an incredibly sophisticated network of vessels that carries oxygen-rich blood from your heart to every cell in your body. The The inside lining of these arteries, called the endothelium, is just one cell layer thick. This delicate layer is supposed to be smooth and slippery, allowing blood to flow freely. When your endothelium is healthy, it produces a molecule called nitric oxide that keeps blood vessels flexible, prevents clotting, and reduces inflammation. Here's where the problem starts. Every time you eat food that causes a rapid spike in blood glucose, several catastrophic things happen simultaneously in your arteries. First, the high glucose concentration in your blood acts like tiny shards of glass, creating microscopic tears in that delicate endothelial lining. Second, the glucose molecules attach to proteins in your blood and arterial walls through a process called glycation, creating what scientists call advanced glycation end products, or AGEs. These AGEs are like rust forming inside your pipes. Third, and this is critical, the spike in glucose triggers a massive release of insulin from your pancreas. That insulin surge is where the real damage accelerates. Here's what most doctors don't tell you about insulin and arterial health. Insulin isn't just a hormone that regulates blood sugar. It's also a powerful growth signal. When insulin levels are chronically elevated, it signals the smooth muscle cells in your arterial walls to multiply and migrate inward, making the arterial wall thicker and less flexible. Simultaneously, insulin activates an enzyme called HMG-CoA reductase in your liver, which dramatically increases cholesterol production. This is endogenous cholesterol made by your own body, not from diet. But here's the truly devastating part. Those microscopic tears in your endothelium from the glucose spikes create inflammatory sites. Your immune system responds by sending white blood cells called macrophages to patch the damage. These macrophages gobble up the oxidized cholesterol particles floating in your blood, becoming what scientists call foam cells. These foam cells accumulate at the injury sites, forming fatty streaks that eventually become full-blown arterial plaques. The plaques grow, hardening with calcium deposits, narrowing your arteries and restricting blood flow to your heart and brain. This entire cascade, from glucose spike to plaque formation, happens every single time you eat foods that raise your blood sugar rapidly. For most people over 50, this is happening 4 to 6 times per day. That's 1,400 to 2,100 arterial injury events per year. Over a decade, that's 14,000 to 21,000 separate assaults on your cardiovascular system. Now, let's talk about the specific foods causing this damage and why conventional dietary advice has been making things worse. The American Heart Association for decades recommended a diet high in whole grains, low-fat dairy, fruit, and lean proteins. They told us to start our day with heart-healthy whole grain cereal or oatmeal, have fruit as snacks, choose whole wheat bread over white, and avoid fats, especially saturated ones. Millions followed this advice religiously. Here's the problem. A bowl of whole grain cereal with skim milk and a banana for breakfast creates a glucose spike that rivals eating a candy bar. Studies using continuous glucose monitors have proven this repeatedly. That seemingly healthy breakfast can raise blood glucose to 160 to 180 milligrams per deciliter in someone with normal glucose tolerance, and even higher in those with insulin resistance. The glucose spike happens within 30 to 45 minutes and triggers a massive insulin response. 2 hours later, the insulin has driven blood sugar down, often creating mild hypoglycemia. This triggers hunger and cravings for more carbohydrates. So, the person reaches for a piece of fruit or a granola bar, both recommended as healthy snacks. Another glucose spike, another insulin surge, another round of arterial damage. Lunch arrives. Lunch arrive. A whole wheat sandwich with turkey, a side salad with low-fat dressing, and maybe a glass of orange juice because it's vitamin C, right? The bread, even whole wheat, breaks down rapidly into glucose. 2 slices of whole wheat bread raise blood sugar faster than 2 tablespoons of pure white sugar. The orange juice, stripped of its fiber, is essentially liquid sugar. Blood glucose spikes again, this time even higher because insulin resistance is building from the morning spikes. More arterial damage. Mid-afternoon, energy crashes. Another snacks. Maybe some crackers with hummus or a smoothie made with fruit and low-fat yogurt. The pattern repeats. Dinner comes with brown rice or whole wheat pasta because we've been told these are heart-healthy, complex carbohydrates. The glucose roller coaster continues into the evening. By bedtime, this seemingly health-conscious person has spiked their blood glucose 6 or 7 times. Their arterial endothelium has been battered repeatedly. Inflammatory processes are in full swing. Cholesterol production has been stimulated multiple times, and they go to sleep thinking they've eaten a heart-healthy diet because that's what every official guideline has told them. This is why Margaret, our yoga-practicing, supplement-taking, fried food-avoiding patient, ended up with 90% arterial blockages. She was following conventional heart-healthy advice to the letter, and it was destroying her arteries 1 glucose spike at a time. The research backing this up is overwhelming and comes from the most prestigious institutions in cardiology. A study from Harvard Medical School published in Circulation followed 8,700 participants for 23 years. They found that individuals with the highest dietary glycemic load, meaning those eating foods that spike blood sugar most dramatically, had a 49% increased risk of coronary heart disease compared to those with the lowest glycemic load. This association was independent of other risk factors like smoking, blood pressure, and cholesterol levels. Another groundbreaking study from the European Heart Journal examined postprandial glucose excursions, the technical term for after-meal glucose spikes, in over 12,000 people across multiple countries. The results were startling. Each 1 millimole per liter increase in 2-hour post-meal glucose was associated with a 27% increase in cardiovascular death. Not just disease, but death. The researchers concluded that post-meal glucose spikes were more predictive of cardiac events than fasting glucose levels. Let me put that in perspective. Your fasting blood sugar, the number your doctor checks at your annual physical, is far less important for predicting heart attacks than the glucose spikes happening after your meals, spikes that conventional blood work never measures. A landmark study from the Cleveland Clinic took this even further. They used continuous glucose monitors on 500 participants over 65 with no history of diabetes. What they found was shocking. 73% of these supposedly healthy seniors were experiencing glucose spikes into the diabetic range multiple times per day, despite having normal fasting glucose and normal hemoglobin A1C levels. When they followed these participants for 5 years, those with the most frequent glucose spikes had 3.8 times higher rate of cardiac events compared to those with stable glucose. The mechanism is clear. The evidence is overwhelming. So why hasn't mainstream medicine changed its recommendations? This is where we need to have an honest conversation about institutional medicine and financial conflicts of interest. The food industry has spent decades and hundreds of millions of dollars funding research and influencing dietary guidelines. The low-fat dogma that emerged in the 1970s and 80s coincided perfectly with the processed food industry's ability to create highly profitable low-fat products loaded with sugar and refined carbohydrates. When fat is removed from food, sugar must be added to make it palatable. The pharmaceutical industry benefits enormously from the current paradigm. Statin medications for cholesterol are among the most profitable drugs in history, generating over $1 trillion in sales. Beta blockers, ACE inhibitors, blood thinners, the entire cardiovascular cardiovascular pharmaceutical arsenal generates hundreds of billions annually. If the root cause of arterial disease was addressed through glucose management and dietary modification, that revenue stream would collapse. Conventional cardiology continues to focus almost exclusively on cholesterol management through statins while giving dietary advice that perpetuates the very glucose spikes causing arterial damage. It's a perfect system for creating lifelong patients who require multiple medications but never actually reverse their disease. Let me be clear. I'm not saying cholesterol is irrelevant. I'm not saying everyone should stop their medications. What I am saying is that managing cholesterol without addressing glucose dysregulation is like mopping the floor while the sink is still overflowing. You might slow the damage, but you'll never fix the underlying problem. Margaret's story continues, and this is where it gets interesting. After her stent placement, her cardiologist put her on a statin, a beta blocker, and aspirin. Standard protocol. He told her to continue her low-fat diet and keep exercising. 3 months later, despite perfect medication compliance, her follow-up stress test showed concerning results. More ischemia, more restricted blood flow. Her doctor recommended another catheterization to check for new blockages. Margaret was terrified and desperate. That's when she came to see me. I ordered a continuous glucose monitor and had her wear it for 2 weeks while eating her normal heart-healthy diet. The results were damning. Her glucose was spiking above 160 milligrams per deciliter 6 to 8 times daily. Her average daily glucose was 132, well above optimal. Her glucose variability, the fluctuation from high to low, was extreme. Every single marker of glycemic chaos was present. I explained everything I'm telling you now. I showed her the research, and then I gave her a specific protocol to follow, the same protocol I'm about to share with you. Here's exactly what to do to stop the arterial damage and begin reversing the plaque formation that's already occurred. This is not theory. This is a precise evidence-based protocol that has been validated in clinical studies and that I've used successfully with hundreds of patients. Step 1 is restructuring every single meal to prioritize protein and fat first, with non-starchy vegetables, and only then adding limited amounts of low glycemic carbohydrates if needed. Here's exactly what that looks like. Breakfast must contain a minimum of 30 grams of protein and 15 grams of healthy fat with 0 refined carbohydrates and no fruit. The ideal breakfast is 3 whole eggs cooked in 1 tablespoon of butter or avocado oil, alongside either 4 ounces of wild-caught salmon or 3 ounces of grass-fed beef, or 1 cup of full-fat Greek yogurt with a 1/4 cup of raw nuts. Add unlimited non-starchy vegetables: spinach, kale, bell peppers, mushrooms, tomatoes. This combination creates stable blood glucose for 4 to 6 hours. The mechanism is crucial to understand. Protein stimulates glucagon, insulin's opposing hormone, which stabilizes blood sugar. Fat slows gastric emptying, meaning food leaves your stomach gradually rather than dumping glucose into your bloodstream all at once. The fiber from vegetables further slows absorption. Studies using continuous glucose monitors show this breakfast pattern keeps post-meal glucose under 120 milligrams per deciliter compared to the 160 to 180 spike from the typical cereal and fruit breakfast. Lunch follows the same structure. 6 ounces of fatty fish like sardines or mackerel, or grass-fed beef or pastured chicken with skin, alongside 2 cups of mixed non-starchy vegetables sautéed in 2 tablespoons of olive oil or coconut oil. If you want a small amount of carbohydrates, limit it to 1/2 cup of properly prepared legumes like lentils or chickpeas, or 1/4 cup of quinoa. Never bread. And never pasta. Never rice. Dinner is your largest protein meal. 8 ounces of fatty protein, 3 cups of vegetables prepared with generous healthy fats, and optionally 1 small sweet potato or 1/2 cup of wild rice, but only if you're metabolically healthy with no insulin resistance. Between meals, nothing. No snacks. This is critical. Every time you eat, even a small snack, you trigger insulin release. Your goal is to give your body extended periods of low insulin, allowing your cells to regain insulin sensitivity and your arteries to repair. If you must have something between meals, it should be purely fat with 0 protein and 0 carbohydrate. 1 tablespoon of coconut oil or MCT oil in black coffee or tea. This provides energy without triggering insulin. Step 2 is implementing strategic meal timing to maximize the periods of low insulin. You want a minimum of 5 hours between breakfast and lunch, and 5 hours between lunch and dinner. This means if you eat breakfast at 7 a.m., lunch isn't until noon at the earliest, and dinner not until 5 p.m. or later. Then you fast completely until breakfast the next day, creating a 14 to 16-hour overnight fasting window. Why does this matter? Research from the Salk Institute has shown that time-restricted eating, even without changing what you eat, improves insulin sensitivity by 38% and reduces arterial inflammation markers by 41% within 12 weeks. When you combine this timing with the low glycemic meal structure, the effects are synergistic. Step 3 involves specific supplementation to support arterial repair and reduce inflammatory damage. This is not optional if you want optimal results. First, take 3 grams of omega-3 fatty acids daily, specifically EPA and DHA from fish oil or algae oil. This dose reduces endothelial inflammation and improves arterial flexibility. Studies show it reduces cardiac events by 25%. Take this with your largest meal for optimal absorption. Second, magnesium glycinate, 400 milligrams before bed. Magnesium is required for over 300 enzymatic processes related to glucose metabolism and arterial health. It also improves sleep quality, which directly impacts insulin sensitivity. Poor sleep, even one night, can reduce insulin sensitivity by 30%. Third, vitamin K2 in the MK7 form, 200 micrograms daily with a fat-containing meal. K2 activates proteins that remove calcium from arterial plaques and put it back into bones where it belongs. This is one of the only interventions that can actually reverse arterial calcification. Fourth, berberine, 500 milligrams 3 times daily with meals. Berberine is a plant compound that activates the same cellular pathways as the diabetes drug metformin. Clinical trials show it reduces fasting glucose by 15 to 20%, improves insulin sensitivity, and significantly reduces arterial plaque progression. Now, critical medication warning. If you're on blood thinners like warfarin, vitamin K2 can interfere with the medication. If you're on metformin or other diabetes medications, berberine can cause blood sugar to drop too low. You must work with a knowledgeable physician to adjust medications appropriately. Never start these supplements without professional guidance if you're on cardiovascular or diabetes medications. Step 4 is implementing strategic movement patterns that improve insulin sensitivity without triggering cortisol elevation. This is not about hours at the gym. After each meal, walk for 10 to 15 minutes at a gentle pace. This isn't exercise. Dusta in descanso. It's glucose disposal. When you walk within 30 minutes of eating, your muscles pull glucose out of your bloodstream without requiring insulin. Studies show a 15-minute post-meal walk reduces glucose spikes by 30 to 40%. Additionally, twice per week, perform resistance training focused on large muscle groups. Squats, deadlifts, rows, presses. Build muscle mass because muscle is your glucose disposal system. Every pound of muscle you add improves insulin sensitivity and gives glucose somewhere to go besides your arteries. Step 5 is the most controversial but potentially the most powerful. Consider periodic extended fasting under medical supervision.